My name is Dr. Alysha Nensi, and I am an assistant professor of obstetrics and gynecology at the University of Toronto and a minimally invasive gynecologic surgeon at St. Michael's Hospital. The aim of this video is to discuss the medical management of heavy menstrual bleeding and common medications used to treat this condition. What is heavy menstrual bleeding? Heavy menstrual bleeding, or menorrhagia, is a medical condition defined by having abnormally heavy or longer than normal periods. Heavy menstrual bleeding is very common, and 1 in 4 women will experience heavy periods at some point in their life. Heavy menstrual bleeding can have negative consequences on your physical, emotional, and social well-being. If your period prevents you from doing the things you enjoy, going to work, hanging out with friends, or spending quality time with your family, you should speak to your doctor so that it can be investigated and treated. There are many causes for heavy periods, including conditions like fibroids, polyps, and endometriosis. But often, there is no cause that can be identified on blood work or imaging tests. The good news is that there are many effective treatment options for the management of heavy menstrual bleeding. Although some of these conditions require surgery, most of the time, patients can be treated with medications. Medical options for the management of heavy menstrual bleeding consists of both hormonal and non-hormonal medications. Deciding which option is best for you may depend on whether you also need reliable contraception, whether you have any medical conditions which prevent you from using certain medications, what you may have tried in the past, and of course, your personal preference. A common first-line medication for the treatment of heavy menstrual bleeding is tranexamic acid. This medication is a non-hormonal antifibrinolytic agent, which means it prevents the body from breaking down blood clots, which results in less bleeding. This medication is taken by mouth, usually 3 or 4 times a day, only while you're bleeding. Your bleeding usually slows down or stops within 24 to 48 hours after starting this medication. And if your bleeding is not as heavy, you can take it less often. Tranexamic acid can also be used with other treatments like anti-inflammatories. And the most common side effects are indigestion, diarrhea, headaches, or leg cramps. While the label on this medication says that it should be used with caution in women who are at high risk of blood clots, there have not been any studies which have shown that it actually increases your risk of developing blood clots in other parts of the body. Another non-hormonal option for the treatment of heavy menstrual bleeding are NSAIDs, or non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, and mefenamic acid. NSAIDs not only help with period pain, but also reduce the volume of menstrual blood loss by 20 to 50%. NSAIDs are usually prescribed to start on the first day of your period, or ideally the day before your period starts, and should be continued for 4 to 5 days or until your bleeding stops. Ibuprofen can be taken once per day, naproxen is taken twice per day, and mefenamic acid is taken 3 times per day, but they are all equally as effective. Advantages of using NSAIDs for the management of heavy menstrual bleeding include no increased risk of blood clots, minimal side effects, low cost, and the fact that you only need to take them for a few days each month instead of every day. For patients who require contraception, or for those whom other non-hormonal methods may not have been effective, combined hormonal contraceptives are an excellent and highly effective treatment for heavy menstrual bleeding. Combined hormonal contraceptives refer to the oral birth control pill, as well as the contraceptive ring and contraceptive patch. All of these options contain both the hormones estrogen and progesterone. The advantages of estrogen-progesterone contraceptives are that they typically make bleeding lighter and more regular, reduce pain during periods, and prevent unintended pregnancy. Combined hormonal contraceptives can be taken cyclically, which means you would have a withdrawal bleed similar to a period once a month, or continuously so that you don't have a period at all. Continuous use means skipping the week of sugar pills or the week without your ring or patch. Continuous use of combined hormonal contraceptives are a great method for skipping your period and decreasing the amount of blood you lose so that your body can catch up and refill the tank. Continuous use of combined hormonal contraceptives is very safe because it keeps the lining of your uterus thin and actually reduces your risk of developing cancer and precancer of the uterus. Some women may not be good candidates for medications which contain estrogen, such as women over the age of 35 who smoke, women with high blood pressure, a history of stroke or blood clots, or women who experience migraines with aura. There are other options for hormonal medications that help control heavy menstrual bleeding, but that do not contain estrogen. These include medications such as danazol, progestin medications such as Provera or the levonorgestrel IUD, or GnRH agonists and antagonists such as Lupron or Alysha. To learn more about these options, please feel free to review some of the other videos on this site which describe them in more detail. The bottom line is that if you are experiencing heavy bleeding during your periods that is affecting your quality of life, you should speak with your family doctor or gynecologist about your concerns. And depending on the cause of your bleeding, your medical history, and your preferences, they can help you find an option for treatment that is right for you.